So if we think back to public health is a complicated topic, partly because if we think back 75 years ago, Britain was still in the midst of rationing due to the aftermath of the Second World War. And so our diet, the diet of British people, was restricted quite a bit. And that had good impact and negative impact. So because things like sugar were rationed, our teeth were a lot better than they had been before. And there's evidence to suggest that there was less obesity, maybe less diabetes and those sorts of things, but it was still something that people had to deal with. I think where public health has improved is in terms of understanding the factors that contribute to especially chronic health problems. So things like heart disease, diabetes, cancer, for example, autoimmune, well, we don't know so much about those, but certainly things like cancer and heart disease, we know the sort of things like smoking, poor diet, lack of exercise, stressful life circumstances that contribute to these sorts of chronic diseases, which these days really add up to a huge chunk of the NHS, the work that the NHS has to do. So we know a lot about how to deal with these things, and that's due in large part to work that researchers have done to trace the epidemiology of these sorts of diseases. We're not so good in terms of addressing these sort of factors, and I think one of the things that's really clear today, and it has been clear for a long time, more evidence was provided by the pandemic, is that there's a real inequality when it comes to public health. So if you're living in Glasgow in a wealthy part of the city, you're well educated, you have a kind of a middle class background, your public health works out really well for you because you have the means to do all the things you need to live a healthy lifestyle. Not everyone does, but at least there's fewer barriers for you. If you're living in a poor part of the city where there's less access, you have less financial resources to have good food, to go out and exercise in the countryside, for example, and if you're living a very stressful life because of financial insecurity, then those public health lessons are not so good. So I think that's one of the things that I guess all of us in society need to think of, is how do we reduce that inequality so that the NHS doesn't have to deal with so much of that disease burden that we really know how to deal with, we just don't always manage it. Yeah, so if you think of the NHS, and it is one of the most well-respected health systems in the world. There was a reason why it was featured during the opening ceremonies of the 2012 Olympics, although maybe not everyone outside of Britain understood what was going on. The NHS very much is like a top-of-the-line automobile, like a Ferrari, and if you treat that Ferrari well, if you give it the right service, if you fill it up with the top quality petrol, if you ensure that it's clean and the roads it's running on are smooth, that it's going to do a job like no one else, right? But if you don't do those things, if you expect it to subsist with running out of fuel all the time, not filling up the oil, not changing the oil, not servicing it, and if the road that you drive it on is gravel and full of potholes, it ain't going to work very well. So it's the same sort of thing with the NHS. So we have this great system that's revered around the world, but if we keep throwing all these challenges at it, challenges that we could overcome, if we don't provide it with the resources in terms of staffing and infrastructure, but also in terms of the public health resources to prevent a lot of the diseases that it has to deal with, then you're not treating that Ferrari very well, and it's going to break down eventually. So I think all of us would like the NHS to function as a Ferrari and maybe not as a Lada from the 1980s or something like that.